You see them as you travel into your city. You see them on the news. You see them, but do you really see them? How do you respond? How does a believer respond to those who are homeless? And how should we teach our children to respond? Today, I'm so excited to speak with Julianne Gross. Julianne is a licensed clinical social worker who lives and works in Lawndale on the west side of Chicago. Julianne gave me a fresh perspective of thinking about ministering to the homeless. Be sure to share this conversation with your children. Here's my conversation with Julianne Gross. Well, Julianne, thanks so much for joining us today on this podcast. We really appreciate it.
It's great to be here. Thank you for having me.
So, Julianne, you are working in the on the west side of Chicago. Mm-hmm. You are a licensed clinical social worker, and you lead a mobile team, or you're involved in a mobile team. When in your life did you say, "Hey, this is the route I'm headed. This is what I want to do"? I know you grew up in a Christian home, grew up in church. Your relationship with the Lord was always a part of your life. But when was it where you said, "Okay, man, this is the calling God has placed on my life"?
Yeah. So I would say I had an interest in things like therapy and working in recovery and treatment when I was in high school. I wasn't sure in what capacity that was. I would actually say my dad was the one that introduced me to the world of like being a social worker, like a clinical social worker, because he interacts with them in his work as well. And so he was kind of the one that actually first was like, "Hey, you should, as you're looking at college programs, look at this track. And I think you would really enjoy it." And it ended up being something that I really fell in love with in school because it's a very holistic approach to recovery. So social work is not just about looking at the psychological or emotional side of things, but it's looking at the social issues and all of the things that go into like those emotional issues that we face. It's not just about like one realm. It is holistic care. So social work does a great job of looking at that and the environment that people exist in.
Well, I know you have a great calling and you have a great ministry, and you work out of Lawndale Christian Health Center. Mm-hmm. And just tell us a little bit about the ministry. They're located in Lawndale, mm-hmm. One of the areas of Chicago. Tell us about the ministry.
So it's a pretty amazing clinic. I have been very thankful to be led there, honestly. It has been around since about the 70s. The clinic started as a response. Some kids from the neighborhood, high school kids in the neighborhood of Lawndale, were like, "We need affordable healthcare in this neighborhood. There is none." Lawndale is one of the lowest income neighborhoods in all of Chicago. It is also mostly minority residents, and there was just not access to quality healthcare. And so they started reaching out to doctors essentially and being like, "Will you come and just set up like a mobile clinic here?" And since then, like God has just blessed the clinic and it has exploded. There's a whole block that the clinic now operates out of. It has several PCP, like family practice offices. It has dental, optometry, OB-GYN. It has a gym for the residents of the neighborhood, a cafe for people to work out of. It's a really amazing clinic. And then just in the past, like 5 years or so, something that really got started during COVID actually was the mobile health team. And so that is kind of pop-up / mini clinics that operate out of homeless shelters around the neighborhood. And so that's the team that I work on, is specifically in the shelters around the west side of Chicago.
When you're on staff at Lawndale, one of their values is that you move into that area, right?
Mm-hmm. Yeah.
I love what they say, living among in order to clearly understand the issues that face a community. So we really want to focus on homelessness, and we'll introduce that in a second, but kind of give us so you're right in the middle of Lawndale. So give us a snapshot, give us a picture of life in Lawndale.
Yeah. So I really love my neighborhood. I've lived here for about 2.5 years now, and it's been a wonderful place. And so it is it's a very interesting neighborhood. It's kind of divided right down the middle into two parts, the North and South Lawndale. And the clinic kind of sits right on the border of those two sides. North Lawndale is predominantly Black African American. And then South Lawndale, which is better known as Little Village, is predominantly Mexican and Puerto Rican. And so you really cross like one of these roads that kind of separates it, and you feel like you've walked into like an entirely like sometimes different country. I mean, in Little Village, you've got like all of the signs are in Spanish. You have, I mean, the grocery stores look different. The language is different. What people wear is so different. Food is different. It's just a very different like culture in each neighborhood. And so it's a very diverse place, which is awesome and has some pretty incredible history as well. You've got North Lawndale was actually the headquarters. MLK chose it as the headquarters for the Northern Civil Rights Movement. And so there's just a lot of rich history there. You've got Little Village is consistently ranked like one of the top places in the entire country to get authentic Mexican food. Um, it's amazing. So I love that. It's been a wonderful time. But it also definitely has some really big social issues that the neighborhood faces. As I said, it's one of the poorest, lowest income neighborhoods in the city. And as a part of that, uh, a lot of people will note, oh, it's one of the highest crime areas. But crime is normally a symptom of uh, bigger issues, of social issues that a community is facing. Things like economic deserts, like lack of jobs, lack of education opportunities. It is also a result of other things like, so this is an aspect that's really important to my work at the clinic and in the shelter, is substance use is a really big issue facing the community. And that not just this community, but the opioid epidemic is a crisis that our country is facing. It's claiming over overdoses claim over 100,000 lives every single year. In 2022 alone, it was over 100,000, and that's gone up since the year before. And 2/3 of that is just from opioids. And so heroin, fentanyl, things like that are a really big problem in Lawndale. And so that's a big part of what my clinic that I work for does, and what my job specifically is surrounding is substance use.
Now you're on the mobile clinic team, right? So you're going to where people are. They're not normally coming to you, but you're going out. So tell us what that day looks like and who you're ministering to. And we're going to get into some of the homeless thing in a second, but I want to get a picture of Julianne and your life and what you do.
Yeah. So my team works in about 15 different shelters around the city or around the west side. I predominantly work at like 3 to 5 of them. Most often I'm at like 3. And it's kind of more of a, let's focus where we have the most presence. So some of them we are at more often than others. For me, that normally means in the morning, I will go with a doctor or a medical provider and a medical assistant. We normally go out in teams of 3 or 4. And we will do a morning shift for about 4 or 5 hours, seeing medical patients at the shelter. So we have normally spaces within each shelter where it's like an exam room, we have like a medical supply closet, and sometimes that's it. Other times, in the last few years, we've gotten to expand for some of them, and we've gotten, more space. We've been able to add exam rooms to that. But there's still shelters that we go to where everything we have to bring in a very large duffel bag, and we use like a fold up divider and just like chairs and a plastic table, and we just set it up every time we're there. So it depends on what shelter we're at. The atmosphere and culture is very different at each shelter. But I work more at the ones that we have more of like those permanent exam rooms, just because there's more opportunity to do the social work and mental health side of things there.
So, Julianne, in the news, homelessness is every time you turn on the news or you look at a news feed, there's a story about um, homelessness and what's going on there. We see pictures, and sometimes we see pictures, of those who are homeless are kind of on their own, right? And then communities, homeless communities. So for all of us, and by the way, if I ask a question the wrong way, just tell me that's not the way you asked that question, all right? Because I would just like to know how to just communicate. I just want to learn from you in this. We all want to. Let's just start with the big picture. What are the big issues that economics, mental health, we know all that, but just talk about that. What the big issues that cause the homelessness that we're seeing, the rising of homelessness that we're seeing in our country?
It's a very complex issue, understandably. It is not as some people, as some people would imagine, it is not just about access to an apartment. It is not just about chronic homelessness is not going to be solved by just building a big apartment that is going to house everyone. Chronic homelessness is usually a result of holistic issues in a person's life, whether that is severe mental illness. And when I say severe mental illness, I am referring to things like schizophrenia, psychotic related disorders, things like bipolar disorder, things that are severe in the terms of impairing a person's ability to function, and chronic as in it is lifelong. Because everyone experiences mental health issues throughout their life. That is very normal. Severe mental illness is something that is, lifelong and deeply impairs functioning. Things like depression and anxiety certainly can be severe as well. But when you're thinking of shelters, a lot of it is very chronic psychotic related disorders, mood disorders, things like that. Substance use is a really debilitating disorder and has a big role in that. So like even if a person had access to an apartment, I've seen that multiple times. We've helped get someone into an apartment, or they've gotten an apartment and a person is just not well enough to maintain that level of functioning, and might lose the apartment. And that is a lot of that comes from not treating substance use in a best practice way, and that's changing a lot. The way that substance use disorder is viewed, it's continuing to change, but there's still a long way to go with helping people understand how to treat it and how people recover from it, and just the stigma surrounding substance use disorder. So those are two big things that really cause and may help, not help, cause and keep people in homelessness. Of course, things also like poverty and trauma are a big piece in that. And so I would say those are some of the biggest things. When a person has faced homelessness when I say chronic, let me explain what I mean by that. That is not someone who, their apartment caught on fire and they are no longer have a place to stay, which I've seen too. We have a lot of different people that come through. It's not someone who, we have a lot of incoming refugees and asylees right now that are experiencing homelessness. Most of those people will hopefully not experience chronic homelessness, which is homelessness over decades, off and on. And that is what I see a lot of in the shelters I work in, is people who have not had stable housing for sometimes 10, 20, 30 years. And so that type of homelessness is a complex care issue.
If you're just zooming out and you're looking at homelessness, would you say the largest percentage of homelessness is chronic homelessness?
It depends. That number might have changed in Chicago even this year, because we had a huge influx of Venezuelan migrants to our city. And so a large portion of our homeless population right now is people who I hope are not chronically homeless. The city is trying to respond to that crisis at the moment. If you asked me this maybe 2 years ago, I would say yes. The largest percentage of people who are experiencing homelessness are going to be people who it's chronic, it's off and on. Normally a smaller percentage who are experiencing it for short amounts of time. I would say like a short amount of time would be under a year.
So break it down a little bit. Men, women percentages, more men, more women. How does that work?
So as a whole, that's a good question. As a whole, I actually am not 100% sure about that statistic. The shelters that I work at are predominantly male. And that does tend to be, I do know that it does tend to be more men experiencing homelessness than women. I think that has more to do with safety concerns. I think more men are more likely to be willing to sleep on a train or sleep on the streets. More women are going to kind of be savvy and couch surf in that way, just because safety concerns are very serious when you are sleeping outside or experiencing homelessness. And so the shelters I do work at, it is a significant difference. There's much more men and tend to be more in the middle age range to older adults. So I would say over the age of 45 is where I tend to see the most.
When women are homeless, do you see a lot of children as well?
The shelters I work at are not family shelters. There are family shelters. So there's a prioritization of women with children. So Chicago has a line. It's called the 311 line. Most cities have something similar to it that you can call for like emergency housing or emergency resources. And if a mom with kids calls and says, "I've just lost my home, like I have nowhere to stay tonight," it will be a priority, like a top priority, to get them into a family shelter, hopefully by that day. It is it's just an understaffed and under-resourced resource. So when I call with, my 50-year-old male patient who's just on his own, and I'm like, he's looking for a place to sleep, there's no saying whether or not they're going to find a place for him by the end of the day. So it really does depend.
So let's talk about the danger issue. So if a person was near a homeless encampment or a community, would they be in a dangerous situation?
That's a hard question to answer, because I do not look at my patients as dangerous people. I think that is a big big stigma around people experiencing homelessness, is that people think they're dangerous. People think those with severe mental illness are automatically dangerous because they might be behaving in a way that's perceived as abnormal. But people who have like severe mental illness are more likely to be the victim of violence than the perpetrator of violence, significantly more likely to be the victim. And so when I've not been in danger since my job started. And some of that is like, we do take precautions, like safety is of course a priority at my job. That's why we go in teams together. That is why you have like security and things like that. And so that is not to say that there are not safety considerations for sure. But the vast majority of people who are experiencing homelessness are just trying to like do their best. They're not trying to like hurt anyone. They are often parents themselves. They are like siblings. They are sons and daughters. Like they are just trying to get by, and often just trying to get out of a really tough situation. So I think that is a big misunderstanding, is to assume that someone experiencing homelessness is dangerous.
I think you answered the second part of that question. So not so much a danger to society, but when a person is in a homeless situation, I'm assuming, or correct me if I'm, there's a lot of danger in there. They're often a victim.
Yes, they can be. And I mean, sometimes it's for women, it's different. It might be different for men and women, but we've certainly had our fair number of men showing up to our clinic with, a wound, an open wound of saying, I just got like jumped out on the street and I had my wallet stolen. Like that's really common. And so there is definitely, there's not a lack of there is a lack of security for people, their belongings, their autonomy. There's a loss of that for sure. And then for women, especially, there is additional safety risks as well of bodily harm and things like that. So definitely. That's also why I think people tend to stay in communities. You find another person. Encampments can be dangerous, but they can also be a source of safety than being on your own, because there's a lot of community and camaraderie among people who are experiencing homelessness. You develop close friendships, and some of them become like family to each other.
Julianne, if you can, when we're watching the news or when we're in a city and we see homelessness, we see that snapshot of where that person is, right? But as you just said, a lot of those who are homeless are in mid 40s, and older, and so they've had a life. They have family. They have so. If you can, and again, I know there's not one story that fits all. I get that, but can you just tell a couple stories of those and kind of their background and kind of how you have seen where they were and then what got them to this place of chronic homelessness?
Yeah. So I think a lot. I think I'll give I can think of like two kind of sides of that coin. You have, like I said, a lot of my job is helping try and get people to substance use recovery, as it's a big thing that perpetuates homelessness. For a lot of people who have substance use disorder, it was manageable for a time. Maybe you started when you were really young and, it was just something you did like casually, and maybe it became a way of coping with life and with trauma, and it became a more permanent fixture. The more that dependency and that disorder changes the way you think, changes the way that you behave. I've had a patient who he had a family. He has children. He still has children. They don't have a relationship right now, but he used to. He used to see them on the regular. And he had a partner. They lived together. Eventually, it got to the point where, his family had to, for their own protection and well-being, had to say, like, you can't stay here anymore. You can't see the kids anymore. This is not safe for them. And so there is certainly like that cutoff point where a person is no longer, the people in the family have to do that. It is necessary. And so then it makes holding down a job difficult, with substance use, constantly there. It really changes the way you think. And so if you don't have a job, if you don't have family supports, you can't maintain an apartment. You can't maintain that living situation, and people end up on the street, and sometimes for long term. And then I think of some of our folks with severe mental illness, people who, one woman comes to mind who she very much wants to work. She has had schizophrenia since she was a teenager. Showed up very early, so had a history of pretty significant trauma. Wants to be working, wants to be stable, wants to have her own apartment so much, wants to be doing well, like wants wellness and health and independence. But it is so difficult for her to have any sense of stability with her illness because she just doesn't know when it's going to kind of rear its head. Like, there is no saying, we have medications for mental illness. They do not cure those illnesses. There is still symptoms that will never go away. there are still long-term side effects of those medications. And so you have someone who really deeply wants to have a home, to have a life, but is not able to because maybe they don't have access to the care, or it is just so difficult to find a sense of stability when you have that kind of illness.
So here's an individual. They have a mental illness. There's medications you can give to help that. Are those medications readily available to that? So several layers to this thing, and you could add many more layers. I know, but so a person comes in. They have this lady schizophrenia. So there's medication to help her. Is that medication readily available? Is so much of substance abuse and those things, and even mental health, is the accountability of someone helping us through that, right? And so, do you partner? I know you guys are a Christ-centered clinic. Do you partner with churches to kind of help that person through? Because I mean, I see people who are in the best case scenario as far as, they're in a home, they're with their parents, and still they're struggling with all these things. Now I have no support. I mean, it's just overwhelming as I think about that.
Mm-hmm. Yeah. It's overwhelming. There's no other way to describe it. Is it an overwhelming need when people are in those situations? And so to answer your first question about access, that is why we are there, is to try and bridge the access gap, because there's not readily access. So the woman that I was mentioning before, we have just in the past couple of months been able to get her on to what's called a long-acting injectable. So it is medication, an antipsychotic for her schizophrenia, that she can get in an injectable in her arm once a month. And it is versus having to stay accountable for taking oral medication every single day, because it's very difficult for a lot of our people who have, so an aspect of schizophrenia is often disorganized thinking. And so literally someone who has a mental illness that keeps them from being able to have organized thoughts or behavior, trying to take medication on a daily basis at regular times is extremely difficult. And so part of what our clinic tries to do is to people who are able to be on these long-acting injectables, so that they can have that medication in their system. And we can know that even if they go MIA for a couple of weeks, we know that they have their medication, and it might be keeping them more based in reality, at least during that time. And then also we are able to bring medications. So, we see people in the morning, and then in the afternoon, we might be able to drop off their psych medications in the afternoon, so that we can get them started as soon as possible. An aspect of that for substance use is we do medicated assisted treatment. It's called Suboxone, is most often what we use. And that is also medication for helping someone with opioid use disorder or substance use disorder. Well, Suboxone specifically for opioids. And so we have a very low barrier approach to treatment. We try and do harm reduction. So if you are at a point where you're saying, I'm not ready to stop using, that is okay. We will work with you. We will help you. We can get you started on medication still, or we can get you connected with a treatment group. And so a lot of our folks we see are just not ready to do that, stop completely. And that's okay, because it is not an easy thing to do. And it is not best practice to say, okay, well, come back when you're ready to go cold turkey. That results in more people dying, and a lot less people engaging in treatment. So we are trying to make access to those treatments by showing up there, by bringing medications to people, by making it accessible for phone calls and things like that. So
you're working in this every day, and you have such a grasp of just all the dynamics of homelessness. from the mental health issues, substance abuse. You mentioned poverty. You mentioned trauma. I know we hear again. I don't know all the statistics. A lot of veterans um, are homeless because of the trauma they've gone through. So, talk to those of us who are followers of Jesus, and we look at this issue, and quite honestly, we don't know what to do. Right? It becomes a political issue, and we know it's a social issue. It becomes a political issue, but talk about it from a biblical issue. So here we are. We're believers. We see this in our cities, in our areas, on the news. Give us some ways to respond, to think, to pray in this area of homelessness.
There's so many things that people can do, honestly, and I really think this is an issue that we see talked about in the Bible a lot, in pretty direct, blatant ways. I mean, you read Matthew 25. It is pretty straightforward. God, like Jesus is saying, we have to care for the vulnerable in our society. That is a mandate. Part of that is a sign of us loving Jesus and being close to Jesus, is that our life is a reflection of love. If your life is not a reflection of love, then there's something going on there, something that's got to be looked at, because to be close to Jesus is to love other people and to love the vulnerable and the weak in our society. And so I think most people, if they're listening to this, that probably means that they're responding to that just intrinsic thing that happens when you love Jesus, where you want to be loving those folks as well. And when, we see that on the news and our hearts break for those people, that is a good thing. And so, like you said, how do we respond to that? I think there's a really wide range of things. I think it can be as simple as not ignoring people anymore. How many times before I was working with people who were experiencing homelessness, I look at my own life and I'm like, how many times did I, avoid eye contact or not acknowledge a human that was trying to talk to me on the street or walking by my car? The dehumanization of people experiencing homelessness is a very simple way to just start, of realizing that when a person is begging on the street or trying to talk to you on the street, that is a human, that is someone loved by God. We don't need to ignore them, and acknowledging them as a person. It doesn't mean you have to give cash. You can give cash. God does, that money could very well be used for a bus ride or for a meal. But there are other ways. You can also give out gift cards, things like that, to a person who is asking for money. I know I have family members who are big fans of that. They keep a stack of McDonald's or Subway or something gift cards, and they're just like, that's what I give out. And that's a great thing to do. And so I think simple things like that can be a great place to start, of just remembering that these people are humans and they have, they're experiencing something really difficult. You can befriend also those people. A lot of people who are experiencing homelessness are regulars at their corners or their spots. You can bake them bread and bring it to them. You can get to know their name. And so you can form relationships with these folks, even outside of structured responses.
I love that idea, because a lot of times people will say, and we don't know, right? If we give cash, they may use it for drugs or something, and they may use it for a bus ride and a meal. So we just don't know.
Yeah.
But giving a gift card to Subway or McDonald's, they're going to go get something to eat. So that's great.
Yeah.
That's great.
Or a CVS or Walgreens. It's not just food that folks need. It is, toiletries. It is toothbrushes, toothpaste. It is things like that. Socks, gloves. It's cold out right now. People die from frostbite. They die from hypothermia, but they get frostbite. I've seen a lot of missing fingers and toes in the shelter. And so those are all needed things. And so that is a great place to start. More structurally, there are also so many things. If you own a business, you can look at ways to start hiring from this population. There's a huge need for people who, for jobs in this population. And it is really difficult for a lot of people experiencing homelessness to get jobs because many of them have a history with the criminal justice system. And that's not easy to get at work. It might cost your business to do that, but it would also be a really incredible way of helping someone. Work is a life-changing thing for many people.
Julianne, let me ask a question on that. So a lot of business owners are going to listen to this. They're not going to walk into a homeless community and, where would they go? Is it a shelter? Where would they go to say, okay, here are some opportunities. We want to help. We're willing to take that risk, or we're willing to invest. Where would they go to find those who could perform
help connect that bridge that gap? That's a great question. I think it does depend on like the city, like the resources in my neighborhood for connecting people to that kind of thing are going to be different than what's in Pittsburgh. And so to some degree, like I know that like I could go to that a business owner could come to the shelter, some of the shelters I work at, talk to the staff and say, hey, I would like to be intentional about like hiring people from this that live here. This is the kind of thing I need. Like, this is what the level of maybe functioning or process and recovery that a person might need to be at in order to do that. But one of the shelters I work at has an employment program. It could be a direct access path. They do in-house job training. They work at the shelter, and then they graduate from the program and want jobs outside of the shelter. It could be a direct pipeline to that. And so some shelters have that. Some of it is just getting to know the shelters in your area. There's also a lot of employment agencies that if you are saying, like, I would like to be specifically focusing on this population, that's something a lot of employment agents know about the people they're working with. And so I think those are two avenues. Like there are different ways. I think working directly with shelter staff, forming those relationships with shelters in your area is probably the most direct path to make sure that you're really getting people who are experiencing homelessness and are going through some of that job training.
That's great. So gift cards, potentially hiring, again, going through the right avenues for that. That's going to be different in every city for those listening.
There's so many other professions, though, that are relevant. I mean, you're a doctor, you're a teacher, you're just a patient person. Like, your skill set is going to be relevant. And so, like, there is a huge, huge need for, like, literacy, education, even just, there's always, like, we have a medical team. We're always looking for doctors who are willing and nurses who are willing to help. There's tremendous, tremendous need. So there's a lot of professions that would be very lawyers. Oh my gosh, I almost forgot that. If you have a background in like the legal system, there are so many legal issues facing people, and there's tons of need. We overwhelm the nonprofit legal services with referrals often. And so there is so much. If you have extra time and you have a skill set that you think could be relevant, it is probably relevant.
Your ministry is an amazing one. God's called you to something extremely difficult and extremely rewarding at the same time. Talk as we kind of wrap up. Talk about how your relationship with the Lord has changed, how you view things differently from a spiritual standpoint when you're really working among the least of these, those who can't speak for themselves. And as you said, James' passage, this is true religion, that you take care of those who are widows and orphans, those who are disadvantaged in the society. So just personally, Julianne, talk about how God has worked on your heart as you minister in this significant way.
I mean, I would say to start with, the Lord has been extremely faithful to me. It is not an easy world to move into. And there are some very difficult things that you see and face. And God has been very faithful in sustaining me, and whether that is energy wise or with compassion. A lot of people who work in this field experience compassion fatigue. I'm sure you working in a church also understand what I'm talking about. You know, just anytime you're working with people, you're going to experience compassion fatigue. But
Never heard that's a great explanation of that. I never heard that. Great.
yeah,
Yeah.
so I think it can be an exhausting place to be. And so I think God has very consistently brought people into my life to support me. And I look back on my life and I'm like, wow, that person entered my life right at a moment that I didn't even realize that I was going to need like a new source of like encouragement and spiritual support. And like, just, I see so intentionally how people have entered my life to support me and care for me at times that I really needed that. So I think one thing I would say is I have seen God's faithfulness to me, but I have also really been challenged. You should not enter into this world and not expect your faith to be shaken, and to really struggle and have doubts, because seeing suffering up close is very difficult. And it is sometimes difficult to have hope and not have like given to despair, even when we see these large systemic issues facing so many people. And when we hear stories of tragedy and trauma, that is really difficult, especially for me. I was came from a really loving family. I came from a place of a lot of privilege, and had a lot of doors opened to me. And that is not to say that I haven't worked hard, but it is that I have been given many, many blessings in my life. And the biggest of that would truly be like, I've come from a family that has loved me and supported me, and, taught me about God and given me that. And so I think for someone who is going into this field, or starting to engage with it, prepare for that to kind of shake you, and also to just be comfortable with that. There is a tension that exists spiritually for anyone who is working close to the suffering, where we don't understand why this kind of suffering and pain exists. But we still have this hope that there is a good God that loves you, and a good, all powerful God that loves us. And so it's a weird tension. You kind of have to hold both of these things in your hands at the same time. And there's not always, it's kind of a gray space. And so I think I would encourage people to get comfortable with understanding that there is gray, and that we have to hold both of these things, and to also trust that God will bring you back to a place of hope and joy, and just trusting that process, because He does. I do think God always brings us back to that place, but it is not always easy.
Well, I can't tell you how much I appreciate you taking the time. I know you have a lot going on, and so thankful that you have shared with us. And what I'd ask you to do, if you would, to wrap us up, if you would pray for us, pray for those listening. And, you've given I love the practical advice that you've given. And just pray that, we would have a heart to respond like Jesus would, and from a biblical standpoint. So if you would pray for us, I'd really appreciate it.
Heavenly Father, thank you so much for this time. Lord, I ask that you would continue to grow in the hearts of everyone who's listening to this, just a desire to act, that there would be just, a yearning for that, and then excitement. I think we respond out of joy and much more than we respond out of guilt. So Lord, I pray that you would just spring up in people's hearts an excitement to engage with this community. There is so much need, Lord, and I know you care for this population. You care for the vulnerable in our society, and I know you will bring people in to care for those in need. So, Lord, we just trust you, and we just trust this time. I trust my words and Ron's words to you, Lord, and I pray that they will fall on ears that are wanting to hear, and that it will just ring true to people, Lord. And so we just lay that at your feet, and I pray all this in the name of your Son. Amen.
So I love what Julianne said about showing those going through challenging times that they are valued and loved by God. Look them in the eye. Julianne gave us some practical advice. Let's not dehumanize people, but demonstrate the love of Christ. After all, that's what we're called to do. If this podcast has been as helpful to you as it's been to me, please hit the like button, subscribe to our channel, and be sure to share it with someone else. Hey, thanks so much for taking the time to join us on the Journey Podcast.